Alright, now we're going to talk about a myocardial infarction, aka a heart attack. This is still in chapter 25 of TIMB. An MI occurs when there is a prolonged total occlusion of the coronary arterial blood flow. There are two different types, a Q wave MI, which is an infarct that extends through the full thickness of the myocardial wall. Then you have a non-Q wave MI, which is a partial thickness. Some causes could be your thrombosis secondary to arterial sclerosis or atherosclerosis, or arterial spasms. Remember, an infarction is tissue death, so a myocardial infarction is cardiac muscle death. Some complications of an MI would be dysrhythmias. More than 50% of deaths from an MI occur within 72 hours for this reason. We're going to watch for cardiogenic shock, which has a high mortality rate, ventricular rupture, hemopericardium, ventricular aneurysms. Some other complications are arterial embolism, a venous thrombosis, pulmonary embolism, pericarditis, or mitral insufficiency. Some assessment findings. Men typically experience sudden severe chest pain, usually substernal, and may radiate to the shoulder, arm, teeth, jaw, or throat. Women have more vague symptoms, unexplained fatigue, abdominal pain, and shortness of breath. Unlike angina pain, rest and sublingual nitrates do not relieve MI pain. May last for hours or days. Some diagnostic tests, we're going to look at those serum enzymes. So the CKMB, which can elevate 4 to 12 hours. We're going to look at troponin. It can elevate 3 to 4 hours. We can also look at your myoglobin. This will elevate as early as 2 hours. Some say even sooner. Cardiac markers can be found on table 25.3 on page 429. Medical management is aimed at reducing tissue hypoxia and relieving pain, treating shock if there's any shock present, and alleviating any dysrhythmias. We also are going to look at giving thrombolytic therapy. This is IV drugs that dissolve blood clots. There is a 30-minute door to needle time in the ER, so they want this medication given within 30 minutes of coming to the ER. There is a 4-hour window from the onset of symptoms. So this is the onset. So whether they came to the ER right when it happened or if it was 3 hours ago, you have 4 hours from the onset. An example would be TPA. Some contraindications for thrombolytic therapy can be found in box 25.4 on page 430. There are also some surgical management. We've covered most of these in our diagnostics, so we'll let y'all read back through those. Nursing process in acute myocardial infarction. We're going to assess the patient. We're assessing for pain, vital signs, cardiac rhythm, the heart, lung sounds, and peripheral pulses. We're going to administer oxygen, nitroglycerin, IV morphine. There is client teaching on nitroglycerin on page 20, or on client teaching is 25.2 on page 426. Sorry about that. We're going to look for their risk for anxiety or fear. Explain procedures, promote rest, acknowledge grief, and administer prescribed sedatives. We want to evaluate. We're going to make sure their pain is reduced to a tolerable level. We want to reduce their anxiety. And we want to make sure the client has self-reported tolerance of stress. We also have to teach them sexual guidelines for after an MI, which can be found on Client Teaching 25.3, page 431.